Hey, we're Team 2, and we're discussing the current state of patient-centered medical homes, and our group is Kiara Davis, Sophie DeNantis, and Cameron Fink. A patient-centered medical home is a new delivery model of healthcare where the patient becomes the center of care and is integrated into the treatment and decision-making. This model has an emphasis on making sure patients can understand their options and works to improve the health outcomes of disadvantaged populations. Having the patient involved improves self-efficacy, which involves a patient's drive to making improvements in their health. Patient-centered medical homes depend on 5 functions to improve primary health care. This includes care that is comprehensive, patient-centered, coordinated, accessible, and high quality. Comprehensive care relies on a large healthcare team to address all aspects of the patient's physical and mental needs, which includes prevention, acute care, chronic care, and specialized care. Team members that may be involved are physicians, physician assistants, nurses, pharmacists, social workers, and care coordinators. Care coordinators are an integral part of this healthcare team by making home visits, helping patients access additional services outside of their primary care physician, and offering 24-hour support. Some practices are large enough to support all of these team members at one facility, but others have to either send their patients to other providers and services or rotate their staff between practices. Patient-centered care basically means that the patients are completely involved in developing their own care plans and must be given information about all of their options, not just what their physician thinks is right for them. It is important to keep in mind that patients come from a variety of backgrounds, cultural beliefs, and values, and that they might prioritize things differently because of this. Coordinated care is a shared care between hospitals, specialty centers, the community, and the home. Communication between each of these centers is the key to making sure the patient care is cohesive. Having services that are accessible leads to a shorter waiting time and more efficient in-person care. This element of patient-centered medical homes is made possible by integrating technology to improve access to resources. Within 24-hour access to a member of the care team through either email or telephone, questions can be answered by a professional and patients feel a constant sense of support. Researchers have looked at high and low functioning patient-centered medical homes and found what practices made the high functioning ones so successful. They found that high functioning medical homes had regular meetings and went over the goals so everyone on the team understood the coordination of care. The high-functioning homes also provided case management services and patient reminders that help with their success. On the other hand, low-functioning homes had fewer resources and low team morale. Team members had inadequate training and less cohesiveness and understanding of care. As future health professionals, we want to make sure we are providing health care, so I think it is imperative to use those best practices to make the patient-centered medical home successful. Technology and EHRs were discussed in a previous module, so we thought we could implement it into this video. The PCMH model is about individual patient care and managing population health. And through the standardized visit template and electronic patient registries, they can speak to one another and give most up-to-date information about the individual patients in their panel. Interoperability. Moreover, these systems help determine which patient is due for a follow-up or who is the sickest of the sick that needs immediate attention. It is important that registries provide practitioners with alerts and information. One of the major advantages of electronic payment registries is that they keep it current if they're connected to these systems. And as the patient receives both online and physical visits, the charts are updated through that too. The PCMH model would be more beneficial over primary care to certain populations: low-income populations, cancer patients, and people living with HIV. Researchers have already seen improvements in health in low-income populations who utilize the patient-centered medical homes. Populations like people who are living with HIV require regular tests and monitoring. Despite advanced training, primary doctors alone are not always able to provide a comprehensive, stigma-free area that these patients need. Therefore, a patient-centered medical home would be more beneficial to a person with HIV because they would have teams specializing in their care who are able to work around the clock and provide regular checkups. The patients would be more included into their care, and treatment would be in a stigma-free environment. This is also true for other populations who require more complex care. According to Van Den Berk-Clark, the aim of the patient-centered medical home is to improve quality of primary care and lower the increasing cost of medical expenses. The ACA and the Department of Health and Human Services are offering incentives to Medicaid programs who send patients to the patient-centered medical homes to increase the usage. That is a win-win for both the provider involved, who is getting more money, and the patient, who is getting quality, low-cost care. We have 2 discussion questions for you. The first one is, choose one of the 5 main functions of patient-centered medical homes and discuss some of the challenges that may arise. Come up with some ways to improve the challenges for the specific function you choose. And our second question we want you to think about is, predict the state of patient-centered medical homes in 10 years from now. What do you see? How it will change? Relate it back to financing and access.